as we seek to protect the community's health and safety. As we are fully aware, the new coronavirus has disproportionately affected those who have been marginalized and historically underserved in our community. Equity has been at the heart of our response to this pandemic, and our full board is determined to keep that focus as we transition to phase one. I would also like to thank my colleagues on the full Board of Commissioners for their careful consideration and approval of our reopening plan earlier this month, and to the county staff who've been working for months to confront this pandemic, including the work that they have done drafting this plan that we are following now. Our employees have worked carefully and quickly to put all the pieces in place so that our community could move forward rapidly and safely into phase one. I'm particularly impressed with the speed of staff's work, given that the detailed guidance for our contact tracing requirements were shared with us by the state on May 7th, just 8 days prior to our board's approval of the plan. Getting these technical parameters wrong would mean being out of compliance of the governor's prerequisites and possibly putting our community at greater risk for more disease and economic hardship. Finally, and most importantly, I'm calling on our entire community to continue these outstanding work that we've all been doing to keep COVID-19 from spreading. It is so important to understand that entering phase one will not be a return to normal, and that each of us has a responsibility to get this right. Our actions over the last 70 days or so under the governor's Stay Home, Save Lives order has done just that, saved lives. At best, we've been inconvenienced by staying in our homes as much as possible, by keeping physically distant from one another, by wearing these facial coverings that we never thought we'd have to. At worst, the Stay Home, Save Lives order has meant serious economic hardship and mental health hardship, resulting in lost employment, lost school days, lost customers to our businesses, and lost income. Now that we've been approved to enter phase one on June 1st, each of us has an obligation to ourselves and to each other to play by the rules and keep the spread of this virus on the decline. Each of us needs to do everything we can so that we can move forward and not backward. Our success as a community is in our hands. Thank you. And now, I'd like to turn this news conference over to our Health and Human Services Director, Marnie Kyle. Marnie.
Good afternoon. Thank you, Chair Harrington. So first, I want to echo what Chair Harrington has said, that we are very happy that Governor Brown has approved Washington County moving into phase one starting Monday, June 1st. We understand that many in our community and including our local businesses are suffering. Many businesses have been closed or operating at reduced capacity. People have lost their jobs, and many are struggling to pay rent and obtain food or other important resources. So we're excited to take this first step and reopen. But I am reminded every day by public health staff, we need to do this with caution, and we need your help. As more community members start going out and mingling with others, we expect that more people will become sick, and unfortunately, some will need to be hospitalized, and a few may even die. This is a disease for which there is no treatment or vaccine, and a disease that you can spread even when you don't have symptoms. It is unprecedented in our lifetimes. Working with our community partners over the past few weeks, we have increased our testing capacity and hired more people to intensify our contact tracing. These public health measures will certainly help, but they won't stop COVID-19 alone. What you do in this pandemic matters much more. The virus is spread through close contact and being around someone who has the virus for an extended period of time. So when you're out, please maintain 6 feet of distance from other people. The governor has limited gatherings to 25 or fewer people, but we know the more people that gather, the more likely it is for disease to spread. So please limit the number of people that you come into contact with. And I know that you've been told this many, many times, but please continue to wash your hands for at least 20 seconds and to wear the face coverings as Chair Harrington described when you're around others, especially outside of your family. And if you get a call from a county contact tracer who says, you've been exposed to COVID-19 and we need you to stay home for the next 2 weeks, we're asking you to please do this. We know this will be really hard for community members, especially those who don't have any symptoms and they need to go to work, pay their rent, or buy groceries. But we have systems in place to help you if needed. So we're asking you to please stay home until you're clear. Now, I want to say a little bit about the uneven effects of this disease on our community. We were the first county in Oregon to identify a case of COVID-19 at the end of February. In the last 3 months, that number has climbed to more than 700. More than half, 52% of those cases are within our Latinx community. That is alarming, but not entirely surprising as we learn more about where people are being exposed and how this disease is spread. Many in our Latinx community are being exposed at work and then bringing home the virus to their families. These are essential workers. They're the workers who are picking and processing the food that we eat. They're packaging and delivering our food. Each year, we have thousands of agricultural workers who come to our community and many who live here full time. They're providing essential work on farms in order to feed the nation. Because of their work and living conditions, they are at high risk of COVID-19 transmission. Yesterday, we worked with Oregon Health Authority and Virginia Garcia to help facilitate testing of 220 workers at towns and farms here in Washington County. Because some of the residents of this farm tested positive, we're working with the state and the farm to isolate those workers who tested positive and protect others who work at the farm. I want to assure you this will not affect our reopening. Our staff is working very closely with the farm to isolate workers who are positive and limit the spread to others. In closing, I want to thank everyone who contributed to our ability to meet the phase 1 prerequisites by staying physically distanced, by wearing your face coverings out in public, and by practicing great hand washing. Public health will continue to protect all of our health, including the work that we do to protect underserved populations like our agricultural workers, our older residents, disabled populations, and those living in congregate settings. So with that, I thank you for your time today, and we welcome any questions.
Thank you, Marnie. And with that, why don't we recruit the help from Highland to identify our first questioner. Highland, can you help us with that?
Sure, Philip. It looks like our first question is from Ted. And Ted, I'll go ahead and give you the floor.
He's muted still.
Hi, can you hear me?
Yes,
Yes.
we can now.
Okay, I'm sorry about that. I'm just wondering, can you tell us how many of the positive Turner Farms, or how many positive cases have been identified at Turner Farms in Washington County?
So we tested over 220 workers on Tuesday, and we have 7 positives, and we still have a few tests pending.
Okay.
Okay. And if we could have the next question, please, and if you could identify your news organization, that would be helpful for us. So Highline, do we have another question coming?
Yeah, Philip, it looks like Carla will be next. Carla, I'll go ahead and give you the floor, and you'll want to unmute before you speak.
Hello there. Thank you for taking my question. I'm Carla Judah from Coin6. The Oregon health officials have stated that these cases associated to Townsend Farms came from out of state. Are there any worries about more possible cases coming from elsewhere as more migrant workers come to help with harvests now and going into the summer?
So we have been preparing for our migrant and seasonal farm guests to enter our county for several weeks now. And we expected that they would be at risk for COVID infection. And so we have put in place a lot of strategies and systems for testing, for accessing medical care, as well as providing food, sanitary supplies, working with the farm owners to make sure that they have appropriate physical distancing capabilities, both in their living conditions and at work. So we've been anticipating this. It's not surprising that we have some positive cases because of the living and working conditions.
Thank you, Marnie. Do we have another question coming?
Yes. So next up is Virginia Bruce. And Virginia, I will go ahead and give you the floor, and just remember to unmute yourself.
Hi, I'm Virginia Bruce, and I publish the Cedar Mill News, which is pretty local for urban unincorporated East County. And my question is, what would trigger a suspension of phase 1? And the second part is, what would enable us to move to phase 2?
Great question. So I'll start with what enables us to move to phase 2. So I think that in order to move into phase 2, there's a requirement that we need to wait at least 21 days, and that we would need to continue to see a decline in hospitalizations, in the number of cases that are community spread, and continue to see adequate personal protective equipment and the ability for public health and the healthcare system to respond appropriately to the number of cases. What could move us backward is we are going to continue to monitor all those prerequisites and factors that we needed to see declines in. And if we began to see significant increases, Oregon Health Authority and Washington County would need to have discussions about whether we need to move into more restrictive measures. There isn't a number out there that's floating around, but it would be a discussion if we're concerned about significant increases.
Who would make that decision?
That decision would be made in conjunction with Oregon Health Authority and the governor's office. So it would be the county, all three of us would be in conversation.
Thank you.
Great, thanks. And we'll carry on then. Highland, can you identify the next question?
Our next question is from Ted.
Hi, Ted Sickinger again at the Oregonian. how confident are you that some of these businesses are actually going to comply with the social distancing rules and other things to keep employees safe? There have been OSHA complaints that Townsend Farms was exposing employees to potential COVID-19 infections, failing to ensure employees maintain the minimum 6-foot distance, that employees who were sick were coming back to the job immediately, and that supervisors were threatening and belittling workers who expressed concerns about COVID-19. So, I mean, clearly there is a pull in the other direction, and you said you've implemented these strategies and protocols out there to try and help with this, but I mean, the working conditions are not ones that lend themselves to this, and it doesn't sound like this business in particular has been particularly cooperative on that level.
So I am very confident that most businesses in Washington County want to do the right thing and will comply with the physical distancing and the other guidelines set forth by Oregon Health Authority. It sounds like you were specifically asking about Townsend, and what I can tell you is that they reached out to public health both in Multnomah County and Washington County before their workers came into the county and requested assistance and advice on how they could best protect the workers. We believe that these workers were exposed before they came into the county. And our experience with them is that they have been cooperative.
Is there any enforcement mechanism that the county is putting in place in case it runs? Again, this OSHA complaint says the very opposite of that. And I'm wondering, is the county contemplating any enforcement mechanisms if it continues to receive and verify complaints that, businesses are not complying?
So the county does have some enforcement capability, but OSHA is really the arm that would enforce these kind of worker complaints, just like they would in non-COVID times.
Thank you.
All right. Do we have anyone else? Let me just remind folks too that we are trying to monitor the chat room in case you are not getting in the queue and you wanted to chat with us. We'll try to pay attention to that to get questions out there. Do we have another question in the queue, Highland?
Our next question is from Carla.
Hi, yes, Carla again with point 6. Are there any concerns about the safety of the migrant community or potential backlash from locals as these cases potentially can keep arising?
So as I described, we have been concerned about the health and safety of our migrant and seasonal workers for a couple of months, and we've been planning and preparing for their entry into our county. We've been working with Virginia Garcia Neighborhood Health Center and Salud to assure that they have access to health services and testing services. We've been working with the farm owners to make sure that their living and working conditions are as best as we can create, as safe as we can create with them, that we have plans for isolation and quarantine if needed. We are concerned about stigma being placed on these workers. That's why we think it's really important to help everyone to understand that they are really some of the heroes in this COVID-19 epidemic because they have had to continue to work and to expose themselves. It just highlights the social, economic, and health disparities that have existed before COVID-19, and this is being highlighted even more with this infection.
Thank you very much.
This is Catherine. I would like to expand on that as well. From day one, with our first reported case here in Oregon and right here in Washington County, Our board has tried to ensure that every resident of our community, whether you are a short-term or a long-term resident, know that you are important, you are respected, that this disease does not discriminate, that discrimination and stigmatization have no place in our community. So I would ask all of our community members moving forward to continue to be kind and respectful to one another. This disease does not care. It doesn't care about your economic status, your multicultural status. It does not care what your life circumstances are. We need to take care of one another and to help one another. Please, please, be mindful. Please help our community members. We're all in this together.
Thank you, Chair. And we are not seeing any further questions in the queue. I'm going to check in with our two panelists here while people consider if there is another question. If they had any parting words. Marnie, did you have anything else that we haven't covered that you felt we needed to get on the record?
No, I think that Chair Harrington's words were really helpful, and that, you know, we are asking our community to continue to participate in all of the requirements to keep us in phase one and moving toward phase two. And just a huge thank you for everything that our community has done so far.
Yes, to our community members, your efforts to date have made a huge difference. You helped ensure that we flattened the curve. And now, as restrictions are lifted and we transition into phase one of Oregon's reopening strategy, we'll all get to move about more freely, to perhaps return to a work site, to see some of your coworkers. But please do so with care and safety. Be sure to practice physical distancing. Wash your hands frequently. And please consider wearing fabric face coverings. Our future together in continuing to earn the opportunity of less restrictive requirements depends upon each of us doing our part, individually as well as collectively. Please take care, and thank you for being here in Washington County.
Thank you, Chair. And we do have actually one more question, if we can sneak Ted Singinger back in from the Oregonian.
Yeah, thanks again. I'm sorry about that. Can you, and this is probably for both of you, but talk about the costs that you project of the response costs of your plan, and whether or not you've been provided with enough, CARES Act funding or other sources to cover that?
Ted, I also wanted to let you know that, because you brought up the OSHA complaint, and that did not pertain to the Washington County location. So
Okay.
I just want to give you a heads up about that, and maybe you can check with OSHA about exactly what that was. But I don't have that number off the top of my head. What I can say is that Chair Harrington, our county administrator, Washington County, has basically said to our emergency operations center and our public health staff, we need to protect our public, and we need to do whatever is needed to do that. We have received some CARES funding. We are really trying to honor our obligation to be good stewards of that CARES funding and other state and federal funding that we've received for this response. I don't have a total number right now, and I don't know the complete cost at this point.
How much CARES Act funding did you actually receive?
So,
Chair Harrington, did you want to address CARES funding?
sure. So the Coronavirus Relief Fund that was enabled through the CARES Act provided $104.66 million for Washington County. After the act was passed by Congress and signed by President Trump, there was a period of time up through the latter part of April for Treasury, the U.S. Treasury, to put forward the guidance and their expectations for how this money would be spent. This funding can cover expenses specific to COVID-19 from March 1st through the last day of December of this year. So as our recovery through all of this continues into the new year, we may very well have continued costs. We know that there is this disbursement for Washington County. Our Board of County Commissioners approved a draft set of goals and principles in our work session on May 12th. That information is publicly available on the Washington County website, co.washington.or.us. We had two primary goals. One, to do the most good for the most people. And secondly, to adhere to the requirements of the CARES Act funding. So we are moving forward with 4 principles. First and foremost, public health. And that's where all of our county work has been really focused since late in February, to ensure the health and safety of our community here in Washington County and throughout our tri-county health area, our 3 urban counties, as well as the 6-county health region. A lot of partnership and collaboration has been going on these last 13 weeks. So public health. We also are working to stabilize our local economy. So just as Washington County and Washington County's Board of Commissioners approved funding for a small business assistance program, so too did some of our cities here in Washington County. And we're hoping that costs like that will be part of the reimbursement program through this CARES Act funding. There are also other aspects to supporting our local economy, such as making sure that those who need stable housing or continuing to address our houseless community needs. We also know that we have a shortage of childcare here in Oregon. Pre-COVID, we had a problem with that. And with the governor's prerequisites as part of the reopening framework, right now, child care facilities have to operate at essentially about 50% capacity. Well, that's going to be a real problem for our working families as part of this reopening strategy if they have to make a choice, a decision between taking care of their kids or returning to work without child care. So we have to work on solutions to that as well. We also want to try and ensure that we're moving forward with supporting our community-based partners here, our CBOs, who've really done a lot of the grassroots work to help connect our public health experts and our solutions with people throughout our community. And then lastly, you know, we have a lot of folks who have been experiencing a lot of fear and concern during these trying times, and we're hoping that we might be able to entertain thoughts and ideas for encouraging folks to get out and about, but continuing to do so safely through social distancing and whatnot. All of this that I've just spoken about is draft information that the Board of Commissioners will be discussing at our work session this next Tuesday. So if you're interested, please tune into that. It is available through Zoom as well as on YouTube. And we are continuing to be engaged with our county partners here, particularly the cities, on thoughts and ideas, not only for reimbursing their costs for teleworking and keeping government services going over these last 3+ months, but into the latter part of the year. We've all been working tremendously together. Our Oregon and Washington County economy and communities will recover together. So let's try and keep going through this process in partnership and collaboration. Thank you, Ted, for your question. My apologies for being long-winded, providing a long-winded explanation. I'm so very proud of our staff and our partnership and collaboration here in Washington County and the work that my fellow colleagues on the Washington County Board of Commissioners do each and every week.
Thank you, Chair. I think we have time for one last question. We're going to, I think, send this one to Marnie. It's come to us through the chat room, and then we'll conclude our news conference. Highland, do you want to read that question for us?
Sure, Philip. So our question in the chat box is from Virginia Bruce at Cedar Mill News, and she's asking how people can report violations as businesses reopen.
Virginia, thank you. That's a great question. And we do have a email address and a phone number. I don't have it right off the top of my head, but we will make sure that we get that to you.
Excellent. Thanks. I'll share it with my folks.
That would be lovely. Thank you.
Thanks, everybody, for participating in our news conference, and please stay healthy, and we'll see you soon. Thank you.
Thank you.